So hi everybody. Last week we had a talk about heartworm disease here, and our receptionist Sue told me that it was not professional enough, not serious enough. And so this week we had a dog test positive for heartworm disease, and I thought we would talk about how we diagnose it, which is much more serious than last week with the spray and the stuffed heartworm. So this is for Sue. Heartworm disease. How do we diagnose it? Well, we run a screening blood test in the clinic, and if that comes back positive, then we repeat that another time or two in a different way to try to really verify whether the dog has heartworm disease or not. So this is what our tests look like. The bottom one is the one that we usually use to screen dogs. You can see the C, that's the control line, that makes sure the test is working properly. And then T is the test line. When that comes up red, then you know you've got a problem. And then we repeated that with another test from a different manufacturer. This test for heartworm, ehrlichiosis, Lyme, and anaplasma. And you can see the positive test result under the H, which means positive for heartworm disease. Finally, we like to try to see the baby heartworms under the microscope. So this is Lexi, and she's going to put a drop of the blood on a slide, and then she's going to smear this out into a single layer of cells that we can look at under the microscope. Zip right there. And if you look really closely right in the middle, you can see a little wiggliness there. That's the red blood cells being moved by the baby heartworm. So that's how we diagnose heartworm disease. It's an easy diagnosis with the modern tests that we have. Treatment, on the other hand, is going to take 5 months or longer, and it's going to be really expensive and moderately hard on the patient too. So it's far better to prevent this disease than to treat it. So keep on giving your heartworm pills or getting your 6-month ProHeart shots, and let's prevent heartworm disease.